Welcome back. This is Dr. Ilona Gable and Dr. Curtis Gable. He is my husband, facial plastic and reconstructive surgeon. I'm the dentist, and we are here to coach you through week 1 of Myofascial Pain Syndrome physical medicine protocol therapy. We are going to be focusing on posture, which is a skeletal alignment necessary for proper muscle positioning. So skeleton is kind of the framework that holds everything together, so it is critical that it is in the correct position. It's also a requirement for all of the exercises that we're going to be teaching in other videos to be performed correctly. So it's number 1, that is really important. And then the second part is going to be on proper and correct breathing. And the third part will be on the head position. So in general, to be able to be pain-free, we do have to have proper posture, proper breathing, proper head positioning for a general overall health, as well as for this therapy to be successful. So number 1 will be our skeletal posture. So I'll turn around and kind of describe what that means. So proper posture is when we have our ear and the shoulder to be in one line, as well as the hips. So hips are right here. So we want everything to be in the correct position in a nice straight line. So most people, as they either drive a lot or work in front of the computers, they kind of tend to be like more like this. So this is when you're slouching in your shoulders, it actually puts stress on the muscles of the neck. Those muscles are the largest muscles, in the head and neck region. So the back of the neck has stronger muscles, and the muscles in the front, they're weaker, because the head, when the proper alignment like this, nice and straight, then the head is slightly forward of the straight line that runs along the spinal column. So when it's out of alignment and we're like this, then the muscles in the back of the head, or the neck, they contract, they pull. So when they pull, the mouth opens because the front muscles of the neck, they stretch a little bit, so it creates something like this, and the belly kind of comes out as well. So I'm sure you've seen people, just look around, people with bad posture, they usually kind of look like this. So as they walk like this, it does place a lot of strain again on the neck. So as these muscles tighten, these muscles have to stretch, and as a compensation for the mouth just automatically opening due to that incorrect position, these muscles, they're called masseter muscles. They're the main muscles that hold the jaw together or bring the teeth together, or jaw into a closed position. So they contract. As they contract, they end up being very strained, and they're continually being essentially chronically injured due to that continual contraction to compensate for the poor posture. So again, the correct posture will be nice and straight, so the curvature in the back of the head is removed. It's nice and straight. Also this lower back, we want to have more of a pelvic tilt, so just a little bit more forward, so everything is nice and straight. So the second part is breathing. So breathing is also really, really critical. So the breath that is good and healthy breath is the breath through the nose when the mouth isn't really open. So the correct position for the mouth is for the muscles to be relaxed, for the teeth to be slightly apart, and lips being together but not sealed purposefully. So they're just together and just gently unsealed in the front. So that's normal rest position, which we will be actually reviewing in another video. So for good proper breath, and in which we will be doing the exercises, we want to do a breath that's called Ujjayi breathing, which is part of yoga practice. So it's nice, calm, gentle breath that creates settlement of sympathetic system and places the body into more relaxed state of just equanimity and peace and relaxation. So that's the breath that we will be using for the exercises, as well as it's a good breath to practice a general on your own throughout the day. That is a good, nice, calm breath. The first breath that we'll practice is the breath that's called belly breathing. So that is the breath that's going to allow us to be able to do the next step. So belly breathing, I'll turn around. So the normal inhale, if you think of inhale, it's going to be kind of chest rising, and then exhale, coming out. So belly breathing is the opposite of that. So on the inhale, we're actually going to inflate the belly. And also raise your chest, so that creates more space in the diaphragm and creates more room for the air to get in. And on the exhale, you actually go in on the exhale. So normally you think of breathing again and out. So this way it's the opposite of that. So So before we do our Ujjayi breathing, we are going to do 3 of those belly breaths. So those are the breaths that are going to help us to be able to have enough space in our diaphragm, enough room in our lungs to actually create nice relaxing effect of the Ujjayi breathing. So Ujjayi breathing is a breathing that we do through our nose with our mouth relaxed. So again, teeth should not be touching. Lips should be together but not sealed in the front. When we seal the lips with our muscles, we do activate the muscles, which is not what we want. We don't want the muscles to be overactive and activated or strained. So we want them to be nice and relaxed, and we want to take inhales and exhales through the nose, and we're going to do them to a count of 6 each. Inhale to a count of 6, kind of hold it for maybe like 1 to 2 counts at the top of the breath, and exhale to a count of 6. So that's the breathing that is required for peace, calmness, and also for the exercises to be effective. So I'll demonstrate the Ujjayi breathing now. So I'll turn around, maybe that would be easier. So we'll have, again, correct posture. So those are gentle Ujjayi breaths, and we want to do about 3. And for the next exercises that you will learn, that you will be doing during the day, you could do that during driving or at work. Just take a minute, take 3 deep breaths, and then you'll be able to do the exercise. So that's really important. And the third part is the correct head position. So that is really critical as well. So we want the head to be, again, in alignment with our spine and not forward. So as soon as the head goes forward, it activates the neck muscles, it strains the muscles of the mouth or the masseter muscles on the sides, so it creates stress, it creates pain. So we want the head to be in the right place. So for the head to be in the right place, to get it there, so again, correct leg posture, nice and straight with everything in alignment. A deep breath. And then the way to get the head in the correct position, you almost do it like you're going to have a double chin, like that, like push it back and stay there. Don't raise your chest and just relax. So it is slightly back from, even for me, like where I normally would kind of hold it. So it's a little bit back. So that is where you will be when you're doing the exercises. So it's really critical. Posture, breath, and head position.